Hi, good morning. Let me just adjust my background. Let's change it to this or maybe this. All right, so this video is being recorded. I would just like to record this for myself, just in case I would like to go back to this in the future. So the purpose is for me to have this recorded so that um I can review the details later on. Okay, so let me just share with you the information that I'll be studying on for today. All right, it's actually this one. Okay, so since I was promoted as an oncology nurse, I'm starting to study and to learn more about oncology nursing. And of course, there are some courses that I need to accomplish and I need to finish. This is it. Okay. So I think I need to share the sounds. There we go. So describe how chemotherapy helps treat cancer. Discuss how chemo damages healthy cells in the body and how that damage leads to the common side effects of chemo. Li- List at least six common side effects of chemo and describe how to help clients with those side effects. Prepare to help clients with the emotional toll chemo can take during treatment. Demonstrate empathetic communication skills with clients before, during, and after chemo treatment. So during caring for clients, I mean, well, undergoing chemotherapy, of course, we are caring for clients, right? And after finishing this course, these are the things that we should be able to gain. Okay, let's continue on. If cancer was a dandelion, sorry, imagine a beautiful public park surrounded by a lush green lawn. In order to protect the tender blades of grass, pristine walkways are maintained throughout the park, and signs warn visitors to keep off the grass. What happens next? One day, the caretaker, a serious fellow with years of experience, notices that a single dandelion was poked through his perfect patch of grass. Carefully, he crosses the field and plucks it out. A few days later, two more dandelions take its place. So the caretaker prepares a bottle of weed killer and once again crosses the lawn. He sprays the weed killer directly onto the dandelions and down into the earth to poison the roots. Within a week, dandelions appear all over the lawn. Wow. So, what does he do? The caretaker must make a decision. He knows the only way to get rid of all the dandelions is to spray the entire field with weed killer. But he also knows that the weed killer may damage some of the healthy grass in the process. If dandelion was cancer, Plucking it out of the ground would be like having surgery. Spraying just the root is like receiving radiation. Spraying the entire field is similar to having chemotherapy. What's most efficient? The most efficient way to get rid of all the dandelions is spraying the entire field. And sometimes chemotherapy is the best way to get rid of all the cancer. Unfortunately, as a weed killer gets rid of the dandelions, it also damages some of the healthy grass. And while chemotherapy gets rid of cancer cells, it can also damage healthy cells at the same time. So, what exactly is chemotherapy? Well, chemotherapy, called chemo for short, is a drug or combination of drugs that destroys cancer cells. It works by stopping or slowing the growth of quickly growing cells. What is cancer? Cancer, the term used for disease in which abnormal cells grow, divide, and invade other tissues quickly and without control. Unfortunately, chemo can also harm healthy cells that divide quickly, such as those that line the mouth and intestines, or cells that cause hair to grow. It's this damage to healthy cells that causes the common side effects of chemo, including nausea, vomiting, and hair loss. Depending on the type of cancer and how advanced it is, chemo can cure, control, and ease symptoms. Let's go to cure first. In the early stages of the disease, chemo can completely eliminate cancer from the body. Chemo can keep cancer from spreading to other parts of the body. And chemo can ease symptoms without controlling or curing the disease. It is known as palliative care. For example, sometimes chemo can shrink tumors that are causing pain or pressure. So there are more than 200 different chemo drugs available that can be prescribed in countless combinations, doses, and schedules. Chemo treatment is a little bit different for every individual. It depends on the type of cancer, the location, and how advanced it is. So, most people receive chemo in cycles. A cycle is a period of chemotherapy treatment followed by a period of rest. For example, a client may receive 1 week of chemotherapy followed by 3 weeks of rest. Three, this 4 week time period makes up one cycle. The rest period gives the client's body a chance to build new healthy cells. So, for example, uh, week one is chemotherapy, and week two and week three are rest period, and week four is another rest period, or another set of chemotherapy will be given. Or on week five, another set of chemotherapy will be given depending on the doctor's order. Okay. Cancer, the facts. So we have 4 facts to discuss. First, in the US alone, about 1.5 million men and women are diagnosed with cancer each year. Sadly, nearly 600,000 of them die from the disease. Fact. Another fact. The American Cancer Society estimates that every year, nearly 175,000 cancer deaths are caused by tobacco use alone. Stop smoking. 1/3 of all cancer deaths are caused by poor nutrition, physical inactivity, and obesity. The average age to receive a diagnosis for cancer of any type is 66 years of age. Although here at the clinic, I have some clients who are age 36. but this is the average age. Okay, the average age to receive a diagnosis for cancer is 66. Early detection of cancer through screening has been determined to reduce the number of deaths from cancers of the skin, lung, colon, rectum, breast, and cervix. Wait, I have to do a screenshot. I have to go back just because I need the screenshot. Okay, next. Checkpoint. Chemotherapy works by slowing or stopping the growth of rapidly growing cells, destroying only cancerous cells, stopping the growth of cells in the mouth, intestines, and hair. Okay, that's it. Oh, this is a question. Sorry. Chemotherapy works by slowing or stopping the growth of rapidly growing cells, destroying only cancerous cells, stopping the growth of cells in mouth, intestines, and hair. That's right. So, chemotherapy works by slowing or stopping the growth of rapidly growing cells. How is chemo commonly administered? So, there are four ways: there's topical, oral, injection, and intravenous. Here at the clinic, I usually give intravenous and injection because oral, they can take it at home. Topical, they can do it at home as well. So for topical, some chemotherapy comes in a cream that can be rubbed on the skin. This method is most commonly used for skin cancers. About a quarter of all new cancer drugs now being studied will become available in an oral form, pill, capsule, liquid. Some existing IV drugs also have oral versions. Oral forms of chemo give patients more freedom and control because they can be taken at home and require fewer office visits. Injections. Chemo may be given as a shot in a muscle, usually the upper arm, thigh, or hip. It can also be given as a shot right under the skin in the fatty part of the arm, leg, or belly. So in this clinic, in my oncology unit, I have a patient who needs hormonal therapy. Um, so what I do is I give injection on both buttocks, on the gluteal muscles, just to stop her hormones from activating, to stop the spread of cancer cells. Intravenous. The most common way chemo is given is through an IV where the drug goes directly into the vein. So, chemotherapy patients usually receive their chemotherapy drugs through their veins, and it usually takes a few hours to a whole day. And there are also patients who are receiving chemotherapy drugs for 24 hours. So it depends on the the size of the tumor, the stage of the cancer, and the location of where the tumor is. Think about it. Your client, Mrs. Trask, has breast cancer. As part of her cancer treatment, her physician has prescribed a chemotherapy pill. On several occasions, Mrs. Trask has complained to you that the pills make her sick to her stomach. One day, while tidying up her nightstand, you find five pills wrapped in a napkin. You should. So let's review. So we have a client, a woman, Mrs. Trask. She has breast cancer. As part of her cancer treatment, her physician prescribed a chemotherapy pill. On several occasions, Mrs. Trask has complained to you that the pills make her sick to her stomach. So one day, while you're tidying up, while tidying up her nightstand, you find five pills, which means that Mrs. Trask stopped taking her chemotherapy pill. First, you have to tell your supervisor so Mrs. Trask's medications can be reviewed. Second, confront Mrs. Trask about why she is hiding her chemotherapy pills. Three, throw the pills away in a biohazard bag. Leave the pills where they are. They could be just vitamins. No, I don't think so. So three and four. are bad, you don't do that. I mean, you don't throw it away. You have to discuss it with the patient. Four, you don't need to leave it where they are. You have to discuss it. Okay. And you have to ask if there are vitamins. Tell your supervisor, so Mrs. Trask's medication can be reviewed. Confront. The word confront is not good. Okay, I like this better. So that's right. The pills you found may be Mrs. Trask's chemotherapy medication, or they may be something else. It's important to let the nurse know about the situation so he or she can get to the bottom of it. Mrs. Trask may need a change in medication and or education, more education about her medications. So yeah, the most important thing about chemotherapy treatment is compliance. Okay. Once the patient is in compliance, there must be a problem. So it has to be discussed. All right. Next, catheters and ports. Some IV chemotherapy is given through a thin needle that is placed directly into the vein on the hand or lower arm. However, if the treatment is expected to last for a long time, IV chemotherapy will be given through a special surgically implanted catheter or port, catheters or port. So there are a few patients here in our unit who has ports. Okay, let's read catheters. An indwelling catheter is a soft, thin tube placed by a surgeon into a large vein, often in the chest. One end of the catheter stays outside the body, so the drug can be injected into it. Most catheters remain in place until all chemo treatments are done. Ports. A port is a small round disc that is implanted just under the skin, usually in the upper chest. A catheter connects the port into a large vein. A nurse inserts a needle into the port to give chemo or draw blood. Some ports are used for chemotherapy treatments that take several days to administer. So I have a few patients here who have ports, porta-port, porta-cat. We call them porta-cats here in the Philippines. And normally the oncologist doctor or the nurse, I haven't done it yet because I just started, will have to feel it. So the doctor I've observed or assisted the doctor, the oncologist doctor once. So what he did was that he asked the patient to inhale, exhale, so that he can feel the port here. It's superficial, he can feel it. And then as soon as he felt it, he started poking it with the needle that we use, that is the catheter. So that's when we started infusing the chemotherapy drug. Helping clients with catheters and ports. The most important thing you can do for clients who have catheters and ports is to watch for and report any signs of infection. Redness, drainage with pus, firmness, swelling, unusual warm skin, moderate severe pain, tenderness at the site, and fever. So I have one patient here whose portacat or port was showing some signs of infection like redness. And there was drainage without pus, but just water. And there wasn't any pain, she said. There wasn't any fever, but the redness was really alarming. So what is the problem with chemo? Most chemo drugs kill any rapidly growing cell in the body, which leads to unpleasant side effects. So it stands to reason that a better treatment would be a medicine that could target only cancer cells. An exciting solution? For example, a drug called Herceptin targets cancer cells that have the HER2 gene turned on. This means Herceptin only goes after those cancer cells and leaves the healthy cells alone. So yes, this medication is called targeted therapy drug. So with this targeted therapy drug, the drug only focuses or targets the what do you call this? The cancer cells, and it doesn't touch the healthy cells. The statistics. As many as 25% of breast cancers have the HER2 gene turned on. Current studies on Herceptin show astounding results, and no other cancer treatments are as effective for that type of cancer. So click next for a quick review on what you've already learned. Let's see, checkpoint. Early detection has been found to increase survivability of a diagnosis of skin, lung, colon, rectum, breast, and cervix cancers. True. So if we found it out earlier on, then there's a chance that the patient would survive. Okay, that's right. Early detection has been found to increase survivability of a diagnosis of skin, lung, colon, rectum, breast, and cervix cancer. Common side effects of chemo. Side effects include nausea and vomiting, mouth and throat changes, changes in appetite, fatigue, anemia, bleeding and bruising, hair loss, skin and nail changes, pain, urinary system changes, nervous system changes, immune system changes. Okay, so these are some of the changes or side effects that we should expect. Now, if there are a few patients who experience nausea and vomiting on day 3. So, for example, on day 1, the patient received the chemotherapy. Day 2, she seems fine, but day 3, she seems to be nauseous. And that's when she started vomiting. But there are medications that the doctor prescribed as soon as she or the patient um, leaves the chemotherapy unit or the oncology unit. Yes, there are mouth and throat changes, um, especially during the infusion of the chemotherapy drug. There are some drugs that you could taste. So this is also the side effect of the chemo. Changes in appetites. Most of the chemotherapy patients loses their appetite. They're saying that they cannot taste the food that they're eating. That's why they don't want to eat anymore. So what I suggest as a nurse is to just force herself to remember what it tastes like and just think that if she eats or if he keeps eating, then he'll continue to progress and to be better. Fatigue, yes, this happens. They just lay in bed. Some of them have dizziness too. On day 4 or 5, anemia, yes. Because one of the side effects of what do you call this? Of chemotherapy is affecting the blood. So of course, neutropenia is one of the most common side effects, but with the red blood cells, it's also but it can also be possibly affected. Bleeding and bruising, yes, this happens because of anemia. And because the platelet counts also gets diminished as a result, as a side effect of chemotherapy drugs. Hair loss, some patients lose their hair by their second cycle. Some doesn't even have any effect on them. So they still have their hair, even though it's their fourth cycle. Skin and nail changes. Some of my patients have their oral chemotherapy agents taken at home, and the side effect is having their nails turn into blue. So that's one of the common side effects. Pain, yes, body pain, body weakness, urinary system changes. There's a drug that makes urine red during infusion and day after infusion, and then it turns into a normal color after a few days after. Nervous system changes. Um, yes, dizziness could happen. Immune system changes. Yes, of course. The the main side effect, the common side effect is neutropenia, which means the white blood cell is lowered. So of course, if the white blood cells are diminished, then the patient is very immune to infection. Very not immune, very susceptible to infection. So immunity is lowered. Side effects, nausea and vomiting. Chemotherapy drugs irritate the lining of the stomach and the small intestine. This stimulates certain nerves that activate the vomiting center in the brain, which can lead to nausea and vomiting. Chemo drugs can also slow stomach emptying, which may also stimulate the vomiting center in the brain. How you can help. Tip. How you can help nausea and vomiting. 1, 2, 3, 4, 5. There are 5 tips. Wow, I love this. First, offer bland. Sorry about that. I'm at work. Okay, so offer bland. All right, so offer bland, easy to digest foods and drinks such as plain crackers, toasts, and gelatin. Some people feel better when they eat a meal before chemo, while others feel better receiving the drug on an empty stomach. Follow your client's preference. Serve 5 or 6 small meals and snacks instead of 3 larger meals a day. Have popsicles, fruit ices, ice pops, and our sugar-free candy available for your client to suck on. Report right away if your client vomits regularly for longer than 24 hours after receiving treatment. Think about it. For 2 days following his chemo treatment, Mr. Martinez experiences uncontrollable nausea and vomiting. You bet your best action is to encourage bed rest until the nausea and vomiting go away. Help him meditate to reduce the nausea. Report the nausea and vomiting to your superior. Offer him gelatin and ice chips only. So for 2 days, this is already more than 24 hours uncontrolled. So with this, you have to report it to your supervisor. Because if it's just one time, then you have to offer him gelatin and ice chips. But if it's been 2 days already, then that's different. That's right. Be sure to report any vomiting that persists longer than 24 hours after chemotherapy treatment. Side effects, mouth and throat changes. Remember, chemo drugs harm and the fast growing cells of the cancer tumor, but they can also damage the fast growing cells that line the mouth and throat. This can affect gums, the lining of the throat, and the glands that make saliva. So, how can you help? Mouth and throat changes. First, check your client's mouth and tongue every day for sores, white spots, or infections. Report any problems right away. Help your client keep his or her mouth moist by sipping water, sucking on ice chips or sugar-free hard candy, or chewing sugar-free gum. Perform mouth care after every meal with an extra soft toothbrush. Avoid mouthwashes that contain alcohol. Next, recommend foods that are moist, soft, and easy to chew, such as cooked cereals, mashed potatoes, and scrambled eggs. So think about it. Mr. Wagner is on his 3rd cycle of chemotherapy. Today, you notice that he is refusing all food and is suddenly quieter than usual. When you ask if he has nausea, he shakes his head no, and he refuses your offer of mouth care. You suspect that Mr. Wagner, one, would perk up if he had visitors during mealtime. May have developed mouth sores that hurt when he talks or eats. Yes, he's giving up and is ready to die. Has nausea, but doesn't want to talk about it. I think it's this one. So maybe he's in pain. That's right. Mr. Wagner may have developed mouth sores. Tell your supervisor what you suspect so that he can receive treatment for his painful side effect. That's very painful. Because he could be talking about side effect, changes in appetite. Nausea and mouth and throat problems can lead to a decrease in appetite. Some chemo drugs can make food taste different or it can cause a loss of taste altogether, leading to a loss of appetite. People on chemo can also experience appetite changes as a result of feeling depressed or tired. So, how can you help? How you can help? Changes in appetite. First, stick to a schedule for eating. Encourage your client to eat when it is time to eat rather than um, waiting to feel hungry. Next, serve 5 to 6 meals or snack each day instead of 3 big meals. Milkshakes, smoothies, juice, or soup are great when your client does not feel like eating solid foods. Liquids like this can provide protein, vitamins, and calories. Report to your supervisor if the client cannot eat at all, or if he or she begins to lose weight without trying. Think about it. Despite eating 3 meals a day, Mrs. Silverman, a cancer patient, has started losing weight. You decide to try serving a small, high calorie meal every few hours. Ask Mrs. Silverman for a list of her favorite foods, report the weight loss to your supervisor, all of the above. Of course, all of the above, because these are all good options. That's right. All of these actions are appropriate for Mrs. Silverman. Side effect, fatigue. Fatigue can be caused by anemia, pain, certain medications, poor appetite, trouble sleeping, stress, anxiety, depression. So, how you can help? Fatigue. Oops, sorry. I have to go back. I forgot to screenshot. So, fatigue can be caused by anemia, pain, certain medications, poor appetite, trouble sleeping, stress, anxiety, depression, and these are the ways for you to help. Help your client relax and decrease stress. Some ways to do this include meditation, prayer, and yoga. Light activity can also ease fatigue. Help your client take 5 to 15 minute walk or to do light housekeeping duties like folding laundry or dusting tables. Recommend your client to take a planned short nap during the day. Be sure the nap lasts less than 1 hour or it could interfere with nighttime sleep. Okay, so think about it. Mr. Bishop is in the middle of his fourth cycle of chemotherapy. For the last few days, he has refused to get out of bed, saying he is so tired. You should, one, restrict visitors and let him rest. Explain that short periods of activity may help reduce his fatigue. Increase the protein in his diet. Discuss hospice care. Okay, so this is the best option. Reduce fatigue. That's right. To fight fatigue, it's important to encourage light activity as tolerated. Okay? Side effect, anemia. Some types of chemotherapy cause anemia because they make it harder for bone marrow to produce new red blood cells. Anemia can make people feel short of breath, weak, dizzy, faint, or fatigued. How can you help? Anemia. Tip. Encourage clients with anemia to eat iron-rich foods such as red meat, egg yolks, dark leafy green vegetables, dark leafy greens, spinach, collards, or kale, dried fruit, prunes, raisins, iron-enriched cereals, and grains. Help your client stand up slowly to prevent dizziness. Think about it. Margaret is undergoing chemotherapy. As a safety measure, you should encourage her to get up slowly from her bed or chair because she is at risk for dizziness. Yeah, one of my patients actually um, complained of dizziness after receiving chemotherapy. So this is because of the side effect, which is anemia. That's right. Chemotherapy can cause a decrease in red blood cell production. This can lead to anemia, and anemia can make people feel short of breath, weak, dizzy, and faint. Side effect: bleeding and bruising. Chemotherapy can lower a number of platelets in the blood because it affects the bone marrow's ability to make them. Platelets are the cells that make blood clot and help stop bleeding. Am I recording? Yeah, it's being recorded. Okay. A low platelet count is called thrombocytopenia. So how can you help? How you can help bleeding and bruising? Tip one, use a soft toothbrush for mouth care. Avoid flossing. Men should use an electric razor to shave. Make sure client wear shoes to walk, even in the house. If a cut or scrape happens, apply gentle pressure until bleeding stops. Report right away if your client becomes constipated. A stool softener may be needed to prevent rectal bleeding. Sigvana. Mr. Calloway receives chemotherapy for leukemia. His care plan includes orders to use a soft toothbrush for mouth care and to skip flossing his teeth. You know, this is because chemotherapy has affected his ability to produce new red blood cells, caused the blood pressure to rise, tripled the amount of platelets in his blood, affected ability for his blood. Okay. Hey, wait. So, you know, this is because chemotherapy affected ability of his, yeah, this one. Affected ability of his blood to clot. Yeah, that's why. Because he has thrombocytopenia. Okay, that's right. Chemotherapy has caused Mr. Calloway to develop thrombocytopenia, a low platelet count, because platelets help stop bleeding. Mr. Calloway is at risk for excessive bleeding, including during mouth care. Yep. So another side effect, hair loss. Some chemotherapy drugs damage the cells that cause hair to grow. Yeah. About 2 to 3 weeks after chemo begins, the scalp may begin to feel tender. Then the hair may begin to fall out. It may fall out a little at a time or in clumps. How you can help with hair loss. Tip number one, reassure your client that her hair will likely begin to grow back within 2 or 3 months after chemotherapy is over. Yes. So I have a client here who is wearing a wig and she looks so pretty. And it's normal. It will grow back anyway. If the idea of hair loss is extremely troubling, help your client make plans to choose a wig or scarves before starting chemo treatments. So one of my clients actually is wearing a very nice scarf. And I always compliment her whenever she comes in wearing her beautiful scarf. Use a mild shampoo, such as baby shampoo to wash her hair and scalp. Gently pat dry and with a soft towel. Remind clients that with hair loss, remind clients with hair loss to protect their scalps by wearing a hat or scarf when outside. Yes. And we should also apply some sunscreen too. Think about it. Your client, Mrs. Marshall, had been pretty upbeat about her cancer treatment until her hair started falling out. But today, you find her crying and she asks you why the cancer is attacking her hair. You should explain that it is a drug, not the cancer that causing hair loss. Yes, reassure her that her hair should grow back once her treatment is over. Yes, spend extra time on her personal care to help her feel special. Yeah, why not? All of the above. That's right. All three actions are appropriate for Mrs. Marshall. Next, the skin and nail changes. Sometimes of chemo damage the fast-growing cells in skin and nails. While it may be painful and annoying, most skin and nail problems are minor, including itching, dryness, redness, rashes, and peeling. Sensitivity to the sun, darkened, yellow, brittle, cracked, or loose nails. So here's how you can help. Wash with a mild moisturizing soap. Add colloidal oatmeal powder such as Aveeno to bath water when your client's whole body itches. Pack, do not rub skin dry after bathing. Apply fragrance-free cream or lotion while skin is still damp. After washing, use cornstarch as a dusting powder. Oh, oops, just a moment. Help your client avoid direct sunlight and use sunscreen when outside. Wait, sorry, I think I forgot to do screen. Okay, suggest your client to protect her skin and nails by wearing gloves when if washing dishes or doing housework or yard work. Think about it. Mr. Cam's chemotherapy treatment is causing his skin to become dry and itchy. You should rub his skin vigorously with a towel to remove. No, you shouldn't rub. You should pat. Encourage Mr. Can to sit in the sun for 30 minutes. No, you shouldn't. You should avoid sun exposure. Apply lotion after bath time to his dampened skin. Yes, apply lotion. Uh, yeah, probably. Apply lotion after bath time to his dampened skin. Hmm, not sure if should be dampened. No, you shouldn't apply. I think it's better to add Avena in the bath. So I think it's none of the above. I'm not sure. Yeah, it's this one. So apply lotion. Please dampen skin. That's right. You should never rub, never rub. Only pat it dry and direct sunlight and make the problem worse. Applying lotion after each bath is the only appropriate action for Mr. Pan. Side effect pain. Pain can be caused by the cancer itself or by chemo. Some chemo drugs can cause burning, numbness, tingling, or shooting pains in the hands and feet, mouth sores, headaches, muscle pains, and stomach pains are also possible. Oh no. So tip number one, report any changes in pain right away. There are medications available to help with those pain. Before reporting your client's pain, ask where it hurts, what it feels like, where the pain is on a scale of 1 to 10. Um, what he or she has tried to help to relieve pain. For clients who have pain, most of the time, it's important to take pain medicine on a regular schedule, even when not in pain. Pain will be harder to control if the client waits until he or she is in pain before taking medicine. Yeah. So most of the time, the doctor prescribes pain medication before the chemotherapy begins. It's called the pre-medication. So 30 minutes prior to giving chemotherapy, I usually administer pain medication through IV or orally, depends on the doctor's order. Deep breathing and yoga can help reduce tension, anxiety, and pain. Think about it. After chemo treatment, Miss Dean complains of shooting pains in her hands and feet. She also tells you that she aches all over and that her pain is an 8 out of 10. This isn't worth it, Miss Dean says. I'm going to stop having chemo. You should report Mrs. Dean's pain immediately so it can be treated. Agree with her decision to stop chemo. Realizes she is just being dramatic because chemo is not painful. Tell her that pain is a normal part of the cancer treatment, but it will pass. So this is ignoring, actually acknowledging. Tell her that pain is normal part, yeah, but it shouldn't. She should treat it, okay? So as a nurse, you should report it. That's right. Chemotherapy can be painful. However, most types of pain can be treated. You should report Mrs. Dean's pain right away so that she can get relief. The decision to continue chemo or not is hers to make, but it is best made when her pain has been managed, not when she is in distress. Exactly. So Chemo brain, what is it? Research shows that some chemo drugs can cause changes in the brain that lead to distressing yet temporary mental changes. Think about your clients undergoing chemo. Does your client have trouble remembering, concentrating, finding right word, doing two things at once? Brain exercises can help keep your client's mind sharp during this time. Let's brainstorm. Click here. Think of at least three things that you can do to help your clients exercise his or her brain. Click here to type your ideas. Can I? Oh, wow. Maybe play mind games like puzzles. What else? Maybe read a read a book and answer comprehension questions after. Mm, maybe. Mm, what else? There's three things you can do to help your client exercise. Remember, uh, or memorize numbers. Memorize phone numbers of significant people. For example, caregiver, doctor, nurse. So brain exercises can help keep your client's mind sharp. How can you help? Here are a few ways. Find a crossword puzzle in the newspaper and help your client work through the clues, such as replying to read a new novel. See? Recommend he or she keep a journal to write down his or her daily thoughts, memories, etc. See? Yay, I was right. Next. Side effect, urinary system changes. Some types of chemo damage cells in the kidneys and bladder and may cause burning or pain when urinating, frequent urinary incontinence, blood in the urine, orange, red, or dark yellow urine that has strong medicine odor. So how you can help. Tip number one, encourage your client to drink plenty of clear fluids while receiving chemotherapy. Good choices include water, fruit juices, clear sodas, and decaffeinated tea. Limit beverages that contain caffeine as they can irritate the bladder and make extra work for the kidneys. Report right away if your client is experiencing pain with urination or if you notice blood in the urine, as these can be signs of infection. Think about it. Since receiving chemotherapy, Mrs. Fletcher's urine has a dark yellow tint and smells strongly of medicine. You know that you should expect to see blood in her urine. This is a normal part, no. Limit Mrs. Fletcher fluid, no. Encourage husband to drink plenty of clear, yes. Offer coffee, tea with each meal, have flush, no. Should only be clear, no coffee, no coffee. So that's right. You should encourage clients undergoing chemotherapy to drink plenty of clear, caffeine-free liquids. And remember that blood in urine is never normal. Nervous system changes. Some chemo drugs can cause damage to the nervous system. Symptoms may include tingling, burning, weakness, or numbness in hands and feet. Um, clumsiness or feeling off balance, shaking or trembling, confusion and memory problems, dizziness. So these are common side effects. Okay, so one of my clients, as I've mentioned earlier, complained of dizziness. And that is part of the side effects of the chemotherapy drugs. Nervous system changes. Tip number one, report any nervous system changes right away. It is important to treat these symptoms as soon as possible to prevent more serious or long-term problems. Number two, provide assistance with ambulation, even if the person didn't need assistance before the chemo. Teach your client to walk slowly and to hold on their handrails when using stairs. Tip number three, secure, remove area rugs, cover or reroute electric cords that cross over walkways. Okay, I'm not sure if I picture of this yet. There you go. Think about it. Your client, Michael, has always been sharp and clear-headed. After several cycles of chemotherapy, you notice that he is having trouble remembering events and often seems confused. You know that this is normal part of chemotherapy treatment. These symptoms have nothing to do. No. Michael needs extra rest to get rid of these and all. You should report that he's changing mental state right away. So this is a normal part of chemotherapy treatment. This is, I wait. So you should report changing mental status right away. Okay, there you go. That's right. While mindful symptoms may be temporary side effects of chemo, you should always report change in mental status. So yeah, just report and report. Okay, just a moment. Let me just check my phone. All right. Mm, mhm. All right, there you go. Let's move forward. So side effect, immune system changes. We're almost done. Yay. How long has this been? So it's 50 minutes now. I'm not sure if still gonna be accepted. Um, I don't have membership with Zoom, but let's wait. Immune system changes. Some types of chemotherapy make it harder for bone marrow to produce new white blood cells. White blood cells help the body fight infection. One important type of white blood cell is called neutrophil. A low neutrophil count is called neutropenia. So this is very common. Almost all the chemotherapy patients that I have here experiences neutropenia, but it's okay because it's normal. It's a normal side effect. It's an expected side effect of chemotherapy treatment. So what we do is that we administer a medication called filgrastim. This medication increases the level of neutrophils or the white blood cell count of the patient, and it's given subcutaneously, and it literally or makes wonders. So the following day, the patient has already have increased um, neutrophil count. So follows your hand washing procedures when caring for the clients with neutropenia. Teach clients to wash their own hands before eating, after using the bathroom, and after coughing, sneezing, or touching animals. Limit your clients' exposure to people with colds or flu, and avoid large crowds. Remind clients with neutropenia not to clean their cats, litter box, pick up dog waste, or clean bird cages. Severely neutropenic patients may be advised to avoid fresh fruits, vegetables, and flowers. Think about it. One of your clients, Mr. McDonald, has become neutropenic. You know, this means he is at risk for bruising and bleeding, disease, infection, low blood pressure. So that's infection for sure. That's correct. Clients who are neutropenic have fewer infection fighting blood cells in their bodies. They are at risk for catching colds, the flu, and other types of infection. Checkpoint. Chemotherapy does not cause pain. False. Any pain a client feels is due to the cancer itself. No, that's right. Chemotherapy has many side effects, pain being one of them. Cancer cells themselves are really painful. The emotional effects of chemotherapy treatment, just a moment. Chemotherapy treatment almost always creates major changes in a person's life. You just learned about the physical toll it can take on the body, but chemo can also disrupt daily routines, add stress to family relationships, and lead to fear, sadness, anxiety, and depression. How can you help? Help your client keep the treatment goals in mind. This may help him or her stay strong when things get rough. Next tip, encourage a healthy and balanced diet. Your client's body needs food to rebuild tissues, regain strength, and deal with emotional side effects. Next tip, urge clients to learn as much as they want to know about their disease and treatment. For some, this knowledge can decrease the fear of the unknown and increase feelings of control and empowerment. Next, help your client get some form of exercise on a daily basis. Walking, swimming, stretching, yoga, or even light housework can help fight fatigue, increase appetite, and improve self-image. Next step, suggest clients on chemo On chemo, keep a daily journal during treatment. Writing down activities and thoughts helps some people better understand the feelings they experience. Persuade clients to keep up hobbies they love or to try something new. Hobbies can help pass the time and create diversion for any pain or other unpleasant side effects of your client may be experiencing. Remind your client to take it easy. He or she may not have as much energy as usual. So rest and relaxation are important. Give your client permission to let the small stuff slide and only do the things that are most important. Help your client locate a support group. Support groups are made up of people who share a common experience. Many people with cancer find they can share thoughts and feelings with group members more easily than with anyone else. Talk to a social worker, call your local hospital, or search online for resources. Checkpoint. You should help your client focus on other things like hobbies and activities to direct attention away from pain, nausea, and other side effects of chemo. That's right. You selected the correct response. Okay, so best foods to eat during chemo, liquids. Liquids can help with vomiting. Water, broth, apple, cranberry juice, 7 Up, or ginger ale, decaf tea, liquid food. Liquid foods can help with loss of appetite, such as pureed soups, milk, all types, milkshakes, instant breakfast, drinks, tomato juice, yogurt, smoothies, liquid meal replacements. High calorie foods and drinks that are high in calories or protein can also help with loss of appetite, such as cream soups with lentils or beans, beef, cheese, chicken, cottage cheese, eggs, fish, peanut butter. Sweets, such as applesauce, jello, popsicle, sorbet, ice cream, yogurt. Yummy. High fiber. High fiber foods can help with constipation, such as bran muffins, whole grain cereals, brown rice, peas and beans, fresh fruits, whole wheat bread, whole wheat pasta, dried fruit, fresh vegetables. Okay, low fiber. Low fiber foods can help with diarrhea. Cottage cheese, eggs, fish, potatoes, white rice, bananas, yogurt, gel, sore throat. Um, Oatmeal, grits, cottage cheese, macaroni and cheese, soups, mashed potatoes, milkshakes, puddings, smoothies, yogurt. Okay, review what you've learned. 5 key points. Point number 1. Cancer is a term used for disease in which abnormal cells grow, divide, and invade other tissues quickly and without control. Point number 2. Chemo drugs destroy cancer cells by stopping or slowing the growth of quickly growing cells. Point number 3. Healthy non-cancer cells in the body also grow quickly. When these cells are destroyed by the chemo drug, side effects such as hair loss, vomiting, and loss of appetite occur. Helping clients manage the physical and emotional side effects of chemo is linked to the overall success of treatment. Point number 5, helping clients keep their treatment goals in mind can help them stay strong when the side effects become difficult. Final tips, managing side effects. Remember, chemo drugs attack cells that grow quickly, which is why they work against cancer. But other cells in the body also grow quickly. When these cells are affected, side effects such as hair loss, vomiting, and loss of appetite occur. How can you help? Reassure clients that most side effects of chemo are short-term and will go away after treatment is finished. Remind clients to report any side effects they are having right away. There are often ways to decrease these unpleasant effects. So final tips, communication during chemo. When communicating with clients who are undergoing chemo treatment, it is important to listen. Do your best to hear and understand how they feel. Never brush off, make light judge, or try to change the way the person is feeling. More helpful tips. In service, You learn that chemo treatment can have emotional effects as well as physical effects. Be sure to let your clients know that you are open to talking whenever they feel like it. Be careful when sharing your thoughts and opinions. People with cancer sometimes like to get the opinions of those closest to them about their illness and treatment. Treatment. Never try to answer questions that you don't know the answers to. Offer to call the nurse or doctor for more information as needed. Final tips. When treatment is complete, receiving chemo is difficult, but completing treatment can also be stressful. Your client may feel relieved to be finished, but may continue to worry about the cancer coming back. Having cancer come back is known as recurrence. It is common fear. It is a common fear in people who have had cancer. Final tip. Empower your clients to conquer their fears of recurrence by helping them follow their doctor's orders after treatment is complete. This may include going to follow-up appointments for blood work or scans and making lifestyle changes like quitting smoking or eating better diet. Congratulations. You're finished with the learner section. Click next to move on to the quiz. Good luck. Okay, I will stop recording. Okay. I think this is an hour long now. Okay, I will stop sharing and I will stop recording, and I hope you learned something from this one. I will finish the quiz so I can gain the certification, and if you have any questions, maybe I can help you. But I will share this, okay, and I will upload this on my YouTube channel, and I hope you like it. But like what I've said, this is mainly for my own reference so that when I want to review the lessons, and well, I have a screenshot, and I hope this helps. Okay, if you ever wanted to be an oncology nurse and if you're interested in knowing some more about it based on how I experienced it here in the oncology unit in the Philippines, I am very open to communicating and sharing my ideas. And if you have ideas on how you do it in your own country, maybe we can chat. All right, have a good day. Bye. Thank you.